Today we'll be discussing about dementia. Dementia is a common disorder affecting old individuals beyond the age of 60 years. This is a disease which comes due to an aging process of brain. Because of slow loss of neurons in the brain, the person becomes slow, as in there's loss of memory, or at times there are loss of other important neurological functions. One very important thing that I want people to know is that loss of memory is commonly identified as dementia, but that's completely not true. Brain has 6 more important cognitive domains. Memory is one of them, executive function, social behavior, speech and language, motor perception are other common neurological domains. Loss of neurological function in any of these domains give rise to dementia. It's common in people beyond 60 years of age. As aging is increasing in our country, the disease of dementia is also increasing in our country. The dementia is actually a caregiver's burden because as such there's no proven treatment for this condition. But with a proper identification of disease and medications, we can slow the progression of the disease and we can add years to the patient's life. How to prevent dementia? First, most important thing is early identification of symptoms. For that, if you find any of the elderly people who are behaving abruptly, there's sudden change in behavior of those people, there's any loss of memory, they were able to remember things, then suddenly they have started to forget things. Loss of visuospatial memory, they are inside a room, they are started to roam around in a wrong manner, they started to dash themselves out against the wall. They can have problem in their visuospatial orientation in the brain, so that also is a form of dementia. Third important thing is there's loss of ability to perform previously learned activities. This also can be, like for example, person who was a bank manager was calculating very quickly, has suddenly lost his ability to calculate. Now this also can be increasing, so loss of neurological function, and therefore this is also a beginning of dementia. So when we identify symptoms early, we can catch the disease. Starting medications early can prevent or slow down the progression of disease. Other things that we can do to prevent is, if we commonly involve in activities where the brain is cognitively challenged. For example, playing chess, playing Sudoku, keeping ourselves physically active, like doing exercises 15 to 20 minutes daily in the morning and in the evening time. Restricting our diet to fresh green vegetables and antioxidant rich fruits. All this can prevent or slow down the process of aging of the brain. Treatment as such, there is no proven treatment for dementia, but anticholinergic drugs, anticholinergic drugs have shown to increase the acetylcholine level hormone levels in the brain, and therefore they prevent degeneration of neurons and more activation of neurons, thus helping in neurological function. Commonly used medications are donepezil, rivastigmine, Admenta. Depending upon patient's behavior and patient's loss of memory functions, we do certain tests known as mini-mental scoring examination, and we test them for memory, recent memory, ancient memory, visuospatial orientation and other activities, and depending upon their cognitive domains lost, we plan our treatment according to the patient's memory or neurological functions that have been involved. Cognitive evaluation should be done for people who are beyond the age of 60 years so that we pick up dementia early. Early initiation of treatment can give years to their life. We can retard the progression of this disease. As such, there is no proven treatment for this disorder, but still early detection and early onset of treatment can give years to the patient in proper health. So we should try to find out people around in our community beyond age of 60 who are dealing with all kind of these disorders and bring them to neurological OPDs as early as possible.